Greetings and welcome to our final segment for Fibroid Awareness Month, Conversations on Capitol Hill. We're going to discuss two key acts that are currently being considered in Congress, and we're going to discuss how they relate to you as a member of the Fibroid Foundation community. And we're going to finish by talking about how you can contact your legislators, and we're going to provide you with real solutions on raising your voice to make sure that these really important pieces of legislation become law. So the two pieces of legislation are the Stephanie Tubbs Jones Fibroid Research and Education Act and the Black Maternal Health Momnibus Act of 2021. At the Fibroid Foundation, our mission includes legislation, and we have been on a charted course to raise our own voices on your behalf to see these two key pieces of legislation come to fruition. In 2019, we began advocating on Capitol Hill for the fibroid bill. The fibroid bill covers funding for education and research at the National Institutes of Health. The total funding request is $150 million over 5 years, which is $30 million for each year. And this may sound like a lot, but if you consider the fact that 26 million US women have been diagnosed with uterine fibroids, that's just a little over $1 per citizen. And I've always advocated for the funding of research on fibroids matching the community affected. And I'm sure that you will join us in promoting that same message. I know that we can make this bill become law. The Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021 was originally presented in 2007. Congresswoman Stephanie Tubbs Jones served her constituents in Cleveland for 5 terms. She was a powerful advocate for the underserved. During her time in office, she introduced 64 bills. One of her focuses was on health care disparities. In 2007, she introduced the Uterine Fibroid Research Act of 2007. At the time, uterine fibroids were a relatively unknown condition, and when she was asked why this bill was so important, she said women deserve better. Although the bill did not become law, she was instrumental in educating others through her legislative efforts, and her legacy still lives on. I would like to share a video from Congresswoman Yvette Clarke, who has tirelessly worked to get her dear friend's legislation passed.
Greetings, everyone. I'm Congresswoman Yvette D. Clarke, and I proudly represent New York's 9th District, that's Central and South Brooklyn. And I am so proud to join you here in honor of my dear friend, soror, and colleague, the late, great, Honorable Congresswoman Stephanie Tubbs Jones. Congresswoman Tubbs Jones was a trailblazer. She was the first African American woman to represent Ohio in Congress. In addition, she was one of the first African American women to chair a standing congressional committee, the Ethics Committee, in the House of Representatives. She served as a pillar of excellence, fortitude, and brilliance, a woman of warmth, integrity, and an ever-present source of support. During her tenure in Congress, one of her primary legislative priorities was the Uterine Fibroids Research and Education Act. And as a treasured member of the Congressional Black Caucus, she focused on this issue because African American women are statistically more likely to be affected by this debilitating condition than women of any other race or ethnicity. She would often say, "Black women deserve better." She introduced the bill 4 times, and although it has not been signed into law yet, many more people have learned about the disease due to her legislative efforts. That is why I've reintroduced H.R. 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021, named in her honor and in tribute to her legacy in the United States Congress. For those who don't know, uterine fibroids are non-cancerous growths on the uterus and are among the nation's most common gynecological conditions. Increasing awareness about the uterine fibroids is critical to our efforts to address the national maternal mortality crisis and prevent pregnancy related deaths, as well as tending to the health and well being of Black women. About 26 million women and girls in the U.S. between the ages of 15 and 50 have fibroids, and no group suffers more from fibroids than Black women. Black women are at an increased risk for the disease compared to white women and tend to get fibroids at a younger age and suffer more severe symptoms. Fibroids are estimated to cost the healthcare system $5.9 billion to $34.4 billion annually. This issue has not received the attention, research, nor funding it requires and deserves. So, in honor of my dear friend, soror, and colleague, the Honorable Stephanie Tubbs Jones, through my service, my diligence, and my dedication to not only advancing the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act, but also in championing the issues that fortify protections for marginalized and underserved communities in Brooklyn, New York State, and across our country. Thank you for taking the time to join us in the fight for Black women's health equity. Stay safe, stay strong, stay healthy, and take good care of yourself.
After quite a series of meetings, to our great surprise and pleasure, we learned that Congresswoman Yvette Clarke was going to sponsor the Stephanie Tubbs Jones Fibroid Research and Education Act. The following year, we were equally pleased to see the legislation reintroduced and to see it introduced in the Senate by Senator Cory Booker and Senator Shelley Moore Capito. This is important because fibroids knows no party, and we definitely need bipartisan support to see this bill passed. Now I'll transition to the Momnibus Act. The Momnibus Act, much like the fibroid bill, is for education and research and community support. And it goes a step further by extending postpartum coverage to 24 months for eligible people. And that's particularly important considering the great needs of maternal health that currently exist in this country. I am pleased to introduce Congresswoman Lauren Underwood, who serves Illinois' 14th Congressional District.
Hi, everybody. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I would like to thank the Fibroid Foundation for hosting this event and for all the work you do to amplify the voice of people living with fibroids, to erase the stigma of silence around menstrual health, and to support efforts to find a cure for fibroids. This issue is personal for me. I had surgery to remove my fibroids last fall. And as a co-founder and co-chair of the Black Maternal Health Caucus, I am championing legislation to address reproductive health equity issues in our country. Last year, I introduced a sweeping legislative package to address the U.S. maternal mortality crisis, the Black Maternal Health Momnibus Act, which would make the largest investment in history to save moms' lives and advance birth equity across the United States. But we know there is much more to do on issues that impact women in our country, particularly issues that disproportionately impact Black women. An estimated 26 million American women have uterine fibroids, including a disproportionately high number of Black women. Yet, despite their prevalence, fibroids are too often dismissed and stigmatized. That's why the work you do is so important. By shining a light on this condition, we can help raise awareness about fibroids and the need for federal investment and policy change to support those who are at increased risk for developing fibroids and those who are diagnosed with them. One critical policy that we must advance is the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act, which I am proud to co-sponsor. This bill, led by Congresswoman Yvette Clarke, would invest in fibroids research, improve data collection, establish a public education program, and disseminate important medical information about the disease to healthcare providers. I look forward to working with all of you to get this legislation passed and signed into law. and to continue to advocate for more federal funding to ensure that everybody living with uterine fibroids has access to the care and support they need and deserve. Thank you for lending your talent, your time, and your voices to addressing this critically important cause. I look forward to being with you again in person soon, but until then, take good care of yourselves.
You might be wondering how you can lend your voice to this effort. There are several ways that you can do so. One is by writing your legislators in the House and the Senate. Visit our website at fibroidfoundation.org and you will find templates to be able to send a note to your legislator. This is important because legislators always want to know who their constituents are and how they can be helped. And I'm sure that the Fibroid Bill and the Omnibus Act are very important to you, and your legislators would really like to know that as well. And oftentimes we think that the legislative branch is the only place that we can reach out and raise our voices. Interestingly enough, the state legislators have tremendous power and can make a difference for you locally in your neighborhoods and districts as well. So don't hesitate to write your state legislators as well. They are a powerful ally in this struggle to get these two pieces of legislation passed. If you would like more information on our legislative efforts and how you can join us, visit fibroidfoundation.org, click the tab Legislation to follow our legislative efforts, or click Get Involved to join a chapter or start a chapter in your city. I would like to thank Congresswoman Lauren Underwood for joining us and for her support of the Fibroid Bill and the Omnibus Act of 2020. Also, a special thanks to Congresswoman Yvette Clarke for reintroducing H.R. 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021, and for her continuing efforts to make this bill a reality. And thank you to everyone who has joined us for our final 2022 Fibroid Awareness Month event. If you would like to view any of our Fibroid Awareness Month Real Solutions events, which were aired this month, they are available on our website, fibroidfoundation.org. If you would like to support the Fibroid Foundation, you may do so through our donation button below. Your gift matters in our grassroots work to help women suffering with fibroids and heavy menstrual bleeding. Together, we are making a difference.